Let's go.
Good afternoon and welcome to another edition of Spotlight. I am Venice Bautista.
And I am Kim Sancha. In today's episode of Spotlight, we will have Executive Director of South Asia Field Epidemiology and Technology Network Incorporated, who will share with us her expertise in facing the pandemic. So let us welcome Dr. Maria Consorcia Quizon. Hello, Doctor.
Hi. Good afternoon, everybody. Good afternoon, Kim. Good afternoon, Venice, and to all the listeners and viewers.
So, how are you, Doc? Anong pinagkakabalahan natin during the pandemic?
Of course, it's a pandemic. You know, it's right under. It's within my area of expertise as an epidemiologist. So the root word of which is epidemic. So, usong-uso kami ngayon.
In demand kayo ngayon, Doc.
Yes.
How has 2021 been for you po, like personally and work-wise?
Well, personally, not only 2021, but since the pandemic started in 2020, here in the Philippines in January, it's actually the first time in all of my life that I spent time with my husband and my children. I mean, from before, it was always travel here, travel there, work 24/7, So that this has given me the opportunity to stay at home and actually get to know each other, Where work is concerned naman, it's so frustrating, to Zoom works, right? And all of these platforms wherein you can talk to people long distance. But if you're a manager, iba talaga yung hands-on. And you feel so frustrated if you can't do anything about it except trust that the person at the end of the line is actually doing his or her job. So work-wise, I guess, it has added more stress to me. But physically, napahinga ako. So that's the difference.
Oh, and going back, a follow-up question lang, Doctora. So, yeah, you said work-wise may experience ka. So, since pandemic tayo ngayon, are there any personal favorite personally that you would like to share with us? Yung, sa family during this pandemic that you've enjoyed the most?
Well, as I said, longest time that I've spent time, especially with my husband. I mean, after 37 years of marriage, this last 2 years probably is the longest time, including all those 35 years that we've been together. Now, well, it's not really fun, but actually it's nakakalungkot because my younger son is a doctor. And so we know that we shouldn't be seeing each other. He's working at the hospital, especially during the last year when there was no vaccine, there was no anything, we really hesitated to see each other, especially him, because he knew he might be bringing the virus home to us. And both his parents are already senior citizens, so it's a lot of risk. So yun lang ang nakakalungkot. And I guess, hindi ako nag-iisa in that aspect. All of us are nagtitiis na not see our loved ones or hug them when in fact we see them because of the situation that we are in.
Absolutely, I actually agree about that. Kasi, we need to show some affection, love, but you can do it because of this pandemic, and it really actually saddens, me and I think Ben as well.
Yes, of course.
So yeah. And Doctora, what inspired you to pursue this field, like this epidemiology? So can you explain it to us or give clear about it? So because I know what this epidemiology is all about. So for layman's term or sa mga nanonood sa atin that the person who heard this term, so you might want to share with us, explain.
You know what? Very few people actually know what an epidemiologist is. Ngayon na lang na uso. Can you imagine even as recent as 10 or 15 years ago when they asked me, Doc, ano specialty mo? epidemiology. And then they say, Dok, meron akong sakit dito sa balat, matagal na nangangatil. Dermatologist yun. Epidemiologist, you know. So those kinds. So what is an epidemiologist? Or let's go a little further, no? You know, most schools, medical schools in the Philippines, or I would dare say, globally, the focus is always on becoming a specialist, a clinician. Paano ka maging specialista sa ospital? Very, very few medical schools will actually encourage you or inspire you to go into public health. As any medical student or a doctor, parang, hi, yung preventive medicine na yan, no, ano, is just something na napagdadaanan o kailangan ipasa. But really not to encourage you, ano? And it so happened that when I graduated in the 1983 yon, it was a requirement before you are given your license to practice that you serve 6 months sa rural areas, you know? So, ayun, na-expose ako sa rural areas among the AITAs in Patling, Capas, Tarlac. And then that's when I realized na, you know, yung mga clinicians, ang daming ganon. But for these people in far-flung areas, especially these indigenous tribes, I am all they have. You know, so I may not be, you know, definitely I will not earn if that's what you went to medicine for. Pero parang sa akin, parang akong maliit na Diyos para sa kanila because I'm all that they're counting on. So I, as I said, I chose the path less traveled by. When I got my license, I said, I'll go into public health instead of, you know, being a specialist or a clinician. And then, so public health, and then during that time, the Centers for Disease Control in Atlanta offered a 2-year course sa Pilipinas, which is called Field Epidemiology Training Program, or FETP. And so I got hooked. And that's it. The rest is history. So they say, kaya eto ako, epidemiologist. Bottom line, ano ba yung epidemiology na to? Ang doktor, pagka nagkonsulta kayo see each other on a one-on-one basis, case-to-case basis. So we say, they see the trees. Epidemiologists see the forest. Kasi nakikita mo yung kabuuan, yung mas malaking picture ng kung ano ang health situation ng isang lugar rather than health condition ng isang tao. So that's what field epidemiology is all about.
Doctora, you said that you were with the AITAS, right? So let me just say, at least, even if you didn't earn, it's actually a blessing to them because you help them in a little way that they cannot, you know, afford to, to ask for consultation for a doctor like you. So, iba yung feeling ng doc, right?
No, it's the other way around. Ako na bless.
Ay, okay, gotcha.
Hindi mo mabili yung sense of fulfillment and sense of having help. I mean, up to now, I'm so idealistic, well, whatever you call it, you know? Pero, yun, ang babaw ko. Tuwa na ako ng ganun. Yeah.
Now, moving forward po, like, can you tell us a little bit about SafetyNet? What is it about and why did you establish it?
Okay. So, I started my career, as a rural health practicing physician, no, among the AITAS, and then went on to become municipal health officer, provincial health officer. Kumbaga kung ano talaga yung ladder. And the ultimate of which is I was the head executive assistant of Secretary Dairit during President GMA's time. Para sa akin, where public health in the Philippines is concerned, I've been there, I've done that. From yung pinakamababa hanggang sa Office of the Secretary. Parang, okay, what other challenges? So after yung SARS, I don't know if you were born already.
Aware naman kami sa SARS, Doctor. It's scary, yung SARS na yan. I still remember that one.
Ayan pa isang aking fulfillment because it so happened that I was the executive assistant at the time, and I was the director of the National Epidemiology Center, as well as the spokesperson for the Department of Health. So I'm patting my back I believe we did a good job na hindi dumami ng ganon. So, ang bottom line, after that, parang, ano pa pwede kong gawin? Ano pa ang challenges where the Philippines is concerned? And so I said, okay, tama na yung forgotten country. Let's see if I can do naman international stint. So at that time, the U.S. Centers for Disease Control was encouraging us to form an organization wherein we can do FEPP or the Field Epidemiology Training Program dito sa region natin, meaning Western Pacific region and Southeast Asia region, put them together and provide technical assistance and so on and so forth. So that's what I'm doing right now, SafetyNet. Actually providing technical assistance and supporting capacity building, specifically for field epidemiology sa mga nangangailangan na bansa dito sa ating two regions, mga kapitbahay natin.
That's great from you, Doc, ha?
That's admirable.
Ano yun, timely for this pandemic as well, tama ba?
I know, but you know what? I felt exactly like how OFWs feel. Kasi di ba yung mga OFWs natin, especially the moms, they feel so sad that they're taking care of yung kids ng others o kaya nagtuturo sila sa ibang bansa. Pero yung mga anak nila o dito hindi nila maturuan or hindi nila maalagaan. So even as I'm working or providing technical assistance abroad, sa akin is, eto inaalagaan ko ibang bansa o tumutulong. Paano naman yun dito sa akin bansa?
Tama.
So, nakaka-relate talaga ng todong-todo with the OFWs.
We can see that sa iyong emotion. You are, into it in like deep. So we can see it from here how you are, overwhelmed or happy about it. And based from your, bio, I heard this. Is it NITAG, if I pronounce it correctly? So I believe it's the National Immunization Technical Advisory Group, right?
Yes,
so can you tell me more about it para sa ating nanonood?
Oo, napakasaya ko yun. Napakasaya ko nga because I was telling you that why am I helping other countries and I can't help my own country. So I was so happy when DOH invited me if I can be a member of the National Immunization Technical Advisory Group. So this group was formed specifically to provide yung level ng expertise na maitutulong namin for DOH dito sa, specific for the immunization. No? So I've been doing that since January this year. And there are 6 other, there's 7 of us in NITAG from different levels of expertise and kino-convene kami ng Department of Health. And so whatever recommendations we come up with are given to the IATF, the Interagency Task Force, so high level, yan hanggang sa makarating kay Presidente, yung ganun. So sa ganung paraan kami nakakatulong. And I'm so very happy that I was given an opportunity to do that. And also, among us, they asked, sige, sino gustong maging tagapagsalita? Or, every now and then, kung may mga requests for more clarity sa interviews sa, talk shows, I am one of the experts who were chosen, who were given the task of, sige, magsalita ka dyan, mag-explain ka dyan. So that's what I do for NITAG.
So, Dr. meron na kayong mga schedule niyan. Ano ba yan? All over the Philippines or internationally din ba yan?
For NITAG, it's only for the Philippines.
Okay.
And the speaking engagement, well, you don't call it speaking engagements, but rather ad hoc, hindi naman ad hoc, when needed. For example, sige, tawagan ka ng channel ganito-ganito, tawagan ka ng the chief, so please naman, guest ka namin ngayon, please explain this or that issue. So, no schedule, but depending on how hot the issue may be at the moment or how crazy confusing, that's when they ask us to talk.
Okay, so speaking of the issue, may we know what's the hottest issue at the moment that you share or talk with them?
Well, the hottest this issue still is trying to convince many of us to go for vaccination.
Yes.
You know, and especially those who are at risk, who are the senior citizens, and those with comorbidities or yung may mga sakit, you know. Kasi sila ang talagang at risk, very likely na magkaroon ng severe form or critical form and be hospitalized and die. And so we want to save lives. And so sila ang inuuna. Okay? So, yun yung ano ngayon, yun yung, but then everything depends. We are saying prioritize because there's not enough vaccines at the moment. They come in batches, right?
Yes.
I mean, if there were only enough vaccines, there's no, we shouldn't even be talking about priority.
Yes.
Kumbaga, sige na, vaccinate, you know, the people who are supposed to be vaccinated. But because there's not enough, we need to prioritize. And so, ayun, so from the health workers to senior citizens to comorbidities, and then the hottest is, of course, with the arrival or not arrival, but nagkaroon na tayo ng Delta variant, which is really more nakakahawa, yung ganon, so that the doctors are seeing more and more of the younger age group, yung mga children na nagkakasakit, because initially, for some reason, those below 18 are not at risk. Or even if they develop the disease, very likely mild lang yan, para lang yan natrangkaso, walang problema. Pero ngayon, more and more, dumadami yung mga kaso. Kaya nagkaklamor for bakunahan na rin natin, pati yung mga younger age group. Again, ang issue dito is, asan ang bakuna, please? Paratingin nyo na yung mga bakuna para noon. Hindi natin pag-uusapan na priority. Parang, sige na, let us vaccinate people so all of us will be protected. Okay? Let me just take this opportunity to say na the bakuna is not the magic bullet. Okay? So even if we are forced to wait for our turn, it's not as if we can't do anything anymore to protect ourselves. Because really yung wearing of masks, yung distancing natin, not going out if you really have nothing to do at home, hand washing, those are really, really protective. Remember that last year, nung wala pang bakuna, yun lang ang ginagawa natin.
Yes.
Tama.
Naprotektahan naman tayo, hindi ba?
Totoo.
So, dagdag na lang itong bakuna na to. So, let us not think na, ayan, wala pa kaming bakuna, paano yan? Or, conversely, yung mga nabakunahan ay, fiesta na, we can go out. Nabakunahan na. Oh, no. Please, it's bakuna and still practice the minimum public health standards. Ganun yun.
Agree.
Yes. And speaking of like vaccines, even though may supplies naman po tayo continuously, there are still people who are doubting or scared to get vaccinated. Do you have any messages for those people po?
Okay. One of the things that are, let me backtrack a bit, Whenever we talk about an epidemic or an outbreak, there's always two. One is the real epidemic, and one is the epidemic of fear or panic. And more often than not, it is harder to control the epidemic of fear and panic. And that is the one that wreaks more havoc than the actual epidemic. Having said that, dahil sa access natin sa information, any Tom, Dick, and Harry na magsalita o mag-post, nakukuhang paniwalaan ng mga more gullible or siguro dahil yun ang gusto nilang paniwalaan. And we will just have to respect that, no? So, anong nangyayari? Nagkakaroon ng vaccine hesitancy dahil no matter what the experts or what the government, both and then the national and international health authorities, whatever they say, minsan nasusupersede or hindi natin mapilit or mahikayat yung tao to change their mind regarding vaccine. Okay? So they're gonna say, I heard somebody died. Or somebody got real bad adverse reaction because of the vaccine. No, ang sagot natin doon is that, yes, it may happen. But if it happens, the benefit that you're going to get out of being vaccinated far outweighs the risk that you may face tungkol sa bakunahan. Kaya kailangan po talaga magpabakuna. And when we go for bakuna, we not only save ourselves, we save our family, the community, you know, and then we save the economy. Because if bakunahan, this goes away, then we can go back and bounce back to where we have been before, or even better, right?
Yes, agree.
You know, I'm really loving this interview because you seem so excited about helping people and, you know, being fulfilled by your job. So in all of your years in the healthcare sector, would you say that this pandemic has been your greatest challenge so far?
Yes and no. The greatest challenge for me was nung pumasok sa atin ang HIV/AIDS. You know, because nobody wanted to talk about that.
Oh, yes.
You know, at least ito, for better, for worse, na nagdedebate, nagbabalitaktakan, may news, may whatever. It's out there in the open, you know, but not AIDS.
No.
And we had that opportunity in the early 80s to, you know, if we can, you know, kung talaga hinarap natin yon, we would have been able to stop it dead on its track.
Yeah.
You know, but we weren't able to, you know. Pero we don't have it as bad as the other countries naman, our HIV/AIDS. But still, pwede naman sana natin nagawa ng paraan ng umpisa. So as an epidemiologist, if there's something that I'm not very happy about, or I take it personally na may ginawa ba ako o wala akong ginawa, it's yung sa HIV/AIDS. Okay? But the others, you know, I am so, as an epidemiologist, I'm so lucky, I think, na in my lifetime, nakita kong umusbong yung mga bagong sakit na usually mababasa mo na lang sa libro, right?
Yes.
But in my lifetime as an epidemiologist, there's HIV/AIDS, there's SARS, there's MERS-CoV, there's Nipah, there's bird flu, lahat ng mga yan. And then of course now, so parang professionally ang sarap na na-experience ko ang mga ito in my lifetime.
Wow. In fairness, those viruses, those diseases that you know encountered or you talk about it, you had it with you, and we can see that you are actually inspired, overwhelmed, and you know happy about it.
Oo, kasi normally you're just gonna read it in textbooks.
Yes.
Pero eto, I lived and breathed it, and actually nagkaroon ng pagkakataon to help and contribute in my small way. I mean, what can I ask for pa? I mean, in my career or in my chosen profession.
Exactly. In your field, ano yan, exacto sa'yo yan. So, very good. And, Doctora, what do you think is the biggest lesson that we or you learn, you know, from this pandemic? But before that, we'll take a short break.
Botomoto Halalan 2022, the Daily Tribune special coverage.
Magandang araw mga katribu! Narito na ang mga makakasama nyo tuwing umaga sa programang Gising Na. Roy Pelovelo, Comfy Manalo, Chinky Mangkukang, Vernon Velasco, Kim Sancha at Chirk Balagtas. Abangan ang programang Gising Na mula alas 8 hanggang alas 9 ng umaga sa Facebook page ng Daily Tribune.
Ilabas ng mainit na kape at samahan kami sa inyong pag-almusal, mga katribo.
Sama-sama natin alamin ang mga natatagong istorya sa mga latest na kaganapan sa loob at labas ng bansa.
Simulan ang bawat umaga with good vibes sa mga informative and recreational segments dito sa ating programa.
Maaari niyo rin ibahagi sa amin ang inyong opinion via Daily Tribune Facebook page at TribuneNow sa YouTube.
Makichika na rin sa latest showbiz happenings, mga katribo.
Kaya naman, magkita-kita po tayo mula Lunes hanggang Biyernes, alas 8 hanggang alas 9 ng umaga at magsama-sama po tayo sa
Gising Na!
And welcome back to Spotlight. Still with us is Dr. Quizon from SafetyNet. So before we take a break, we left a hanging question to Doc. So Doc, are you ready to answer my question? Go ahead.
Yes, of course. And we're actually doing some chat kanina. What has this pandemic taught me? In particular, two things. Number one, it's a great equalizer because, we suddenly realize that I need only chinelas and duster, and that's it. I don't even need those shoes or the bags or anything. And the most important thing for me is survive every day. And how do I see to it that my loved ones for the greater population is we can weather this and hanggang sa umalis. So that's the lesson there. How do we survive? It's actually a war. We are at war. And how do you do that? Kailan ba aalis to? Kailan ba matatapos to? Yung ganun. But we just need to survive. The other thing that it has taught me is humility. That this is just a virus. And I think, akala natin kaya na natin lahat. Akala natin with all the knowledge and technology and kaya natin lahat. It pushed us down to our knees. So we became humble. Alam natin na hindi natin kaya lahat. At meron tayo mga dapat gawin para sa sarili natin at para sa kapwa natin. No? I don't want to sound religious. I'm trying to...
It's okay, Doc.
I don't even know if, Catholics or... Para ba, sige, ngayon, lumuhod ka dyan, magmakaawa ka kay Lord. Na dati-dati we do that for granted.
Yeah, I agree.
Those are the two things that I learned from this pandemic.
All right. And follow-up, Doc, anong gagawin mo after the pandemic?
Oh,
just a light question, just so you know.
What do I miss? It's a little haba, no? But in the past 10 years, I've always been traveling because that's the nature of my job. I live off a suitcase. I 3 to 4 times a month, I need to go out of the country. Yung ganun. And I hated waiting yung 2 hours dun sa airport.
Boarding, yes.
Sayang ang oras. I hated that. I hated airport. I hated blah, blah, blah. Now I'm dying to see the inside of the airport. I'm dying to see the inside of the airport. So that's it. The first thing that I probably will do is pack my bags and go.
Travel.
Go sa kung anong kauna-unahang bansa na pwede, na safe na rin. Okay, go there para lang makasakay na aeroplano. Mababaw ko talaga.
It's okay. I think that you of us would love to travel, right?
Hindi siya mababaw at all. I miss it.
No, but I hated it talaga. I hated it na. Parang traveling, gano'n. Pero ngayon, well, I miss it.
Yes. Now, doon naman po tayo sa before the pandemic. What was your life like during, the pre-COVID days? How did you spend your days?
Well, as I said, because, for example, dun sa aking consultancy, my countries of responsibility were India, Cambodia, Indonesia, Myanmar, Bangladesh. And before that, may Laos, may Vietnam, may ganun. So I need to be physically there to monitor and supervise yung staff. So kaya 3 days here, go to the airport, jump off to another country, and so on and so forth. And then, I see these things. Where did you get these photos? Well, and actually, that's the other part that I love is being an events organizer for international scientific conferences. So, which is every other year. So that's what I do. That's a typical day for me. And ang masakit is that I handle Asian countries. So that's our waking hours. Let's say 9 to 5, But then my bosses or my superiors are from CDC Atlanta, which is 12 hours
difference
later than us. Difference. No? So, yung alas 9 ng gabi ko, pagising pa lang sila doon at alas 9 na umaga. And so, aabangan ko sila kung merong ibibili o sasabihin pa na, is this my life? 24/7 na trabaho. Kaya naaabuso ako ng hindi sinasadya. But I'm so blessed because from day one, ever since my experience with the ITAS and having chosen public health, parang hindi trabaho eh. Di ba, if you enjoy something, then you don't realize that you're actually working because work is supposed to be not enjoyable. I have enjoyed all these years. Kaya sabi niyo nga, it radiates. The passion is still there, the interest and everything. So even if it's 24/7, if it's pagod, it's too stressful, ganon, I enjoy it. And I sleep at night with the thought that, okay, I saved at least one life today.
Yeah. And we can actually sense it that you are really happy and parang fulfilled ka sa iyong field. And yeah, it's actually inspiring for all the viewers that, watching right now. And then earlier, you mentioned that you help the AITA communities in Tarlac, right? And I heard that you are also extending efforts to this foundation, the Starkey Hearing Foundation, and I believe it's close to your heart, right?
Oh, yeah.
So can you tell me more about it or us about it?
Ganito. I'm an orphan. Uli lang lubos ako at age 5. I was raised by a grandma who, she was 69 already when I was 5 years old. So I grew up with a fear lagi na anytime she would go. She was 69 at that time, so I need to be agad doon. Mahaba usapan. Pero ang issue dyan, bingi ang lola ko. She nag-streptomycin yata siya at that time, which is nakakasira ng tenga. So I grew up having to shout at my grandmother kasi hindi niya ako naririnig. Yung ganon. So, kaya well-modulated ang boses ko. Yung ganon. Sinisigawan ko lola ko. So, nung nagkaroon ako ng pagkakataon and I met billionaire philanthropist Bill and Danny Austin of the Starkey Foundation, and then they're offering free hearing aids. So I beg, steal, or borrow ako para maparating ko sila sa Tarlac in particular at magbalik-balik sa Pilipinas. Kasi sa dami ng bansa sa daigdig, usually mapupuntahan lang nila ng once, para maikutan lahat. But we tried our best, and kasama ko dito sila Dr. Norby Martinez of UST and so many others na awa ng Diyos. Starkey has really looked at the Philippines as their a home country that they come back every now and then to provide. Okay? So, ano nangyayari? Before they come, at least halimbawa sa province ko, we screen already and say, on such and such day, the specialistas are coming and for those who are eligible or would need it, they will be provided hearing aid. Can you imagine kung gaano kamahal ang hearing aid?
Yeah.
Parang,
mahal.
As in mahal. Hindi ba? Kaya, and anything that is diferensya sa tenga, you usually put that at the back burner for an ordinary family kasi mahal. Hindi naman masakit yun sa tenga eh. Kumbaga, bingi ka lang pero that's not masakit. There's no dugo. There's no anything. It's not life-threatening. So you tend to put that at pero nakakatulong ng malaki. Nakakapag-change. Life-changing lalo na sa mga kabataan na may hearing impairment. Makikita mo, the first time na i-fit sa kanila yung hearing aid, yung mukha nila biglang mag-aaliwala sa iiyak ka talaga. Or even for the moms, pag nakita mo yung mga moms na nag-respond yung mga anak nila na nakarinig, talagang maiiyak ka with them. So, yun. So, nabigyan ng opportunity to be able to touch base with Starkey Foundation owners themselves, and the rest is history, ika nga. So and personally nga, it's for my lola. I feel that inay, hindi kita natulungan kasi nung namatay ka, hindi pa ako tunay na doktor, yung ganon. Pero kung ano yung tulong ko para sa tenga mo, iba na lang ang tutulungan ko para sa'yo.
That's very touching and beautiful. This is something that I can relate kasi I am also, you know, a grandma kid. So, ayan. And then yung ginawa mo is, you know, very mesmerizing.
Tribute, diba?
And then you help a lot of people by the experience that you had prior, and then ayan, so people are benefiting it, so it's actually beautiful and inspiring. So
kumbaga, I paid it forward and I will continue to pay it forward. Well, yun na nga yung, you know, you asked kanina what's the sorry thing during this pandemic is that in the last 2 years hindi rin makatravel ang Starkey group, especially Mr. Bill and Austin and his wife Tani Austin, because they're senior citizens na rin. Yung ganun, so hindi rin sila makabalik sa Pilipinas para tuloy-tuloy ang serbisyo. You know, for those who were provided hearing aid, pati baterya for a lifetime dinibigay.
Wow.
Oo. It's not as if one-shot deal. Here's bahala ka na dyan. Hindi. May follow-up, may bigay ng baterya, may everything. Yeah.
At mahal yan. I actually know na it's mahal because, you know, I know. So, yeah.
Oo. Sa level ng priorities natin, talagang hindi ipa-prioritize ng isang household pag humina ang tenga ng isang miyembro. So, it's really a lot of help.
Yes. And you seem so busy ngayong pandemic, Doktora. And we know naman na during this pandemic talagang your field, the people in your field are the ones who are the busiest. So how do you find your balance with work, with family time, or just finding time for yourself?
You know, believe it or not, I've never prayed this hard before in all my life. You know, I'm surprised. I mean, kulang pa yung, and this is no exaggeration, 5 rolyo ng rosary every day. Because before, I was so busy that I always, you know, when I lay me down to sleep, I tell God, I did so many services naman, no more na lang prayers. Or I'm not gonna go to church, I have no time. Really no time. No time to thank Him at all. Pero mag-upisa ng pandemic, no excuse. You have time na nga there. You're just at home. You better pray. You know, and I have lots of people to pray for. Yung mga kaibigan or colleagues na nagpa-positive. So, and then, actually, and this is true until very recently when I realized that when I pray, am I really praying for others or I'm praying for myself? Kasi napapansin ko, nakakalma ako. Nawawala lahat ng cares and worries ko when I pray. So, yun, parang sarili ko na lang yata ang pinagdadasal ko at hindi yung iba. So, if you ask me, so what do I do to distress myself? You know, some may find this corny or some may find it, she's into religion na naman. Pero yun talaga, it really, really helps, and that's how I distress myself. Not to mention the K-dramas, of course. Yeah.
I'm also guilty of that.
Actually, Doc, yun yung question ko sa'yo, how do you distress? And you answer na yung prayer. Meron pa bang iba? Meron ka pa bang gustong i-add other than prayer? Like, let's say, series, watching, or reading, or anything like that? Maybe cooking, or what? Anything pa?
Ay, nako. You know, ang isang blessing ko is my yaya, who took care of me since I was an infant, is still with me. God. So, don't even say cooking. I don't do that, you know? or sa bahay. One thing pala, and I challenge all of you.
You're challenging us na, ha? Go.
Pwede ba itapon na yung mga dapat itapon sa bahay? I mean, all of us, to a certain extent, are such hoarders.
Yes.
You know, it's like, at the start last year, nung walang magawa, I started to, you know, ayos-ayos.
Decluttering, yung mga yan.
Declutter. And then, you know, as I look into them, ay tatabi ko muna, I ended up not throwing them. Why am I so attached to this things which I
never used?
Shouldn't be, right? At the end of the day, wala ka rin tinapon. Somebody once said that if you have something na you haven't seen and you did not miss for 1 year, it means you can throw that away. Kasi wala na yun eh.
Tama, yes.
Hindi mo na nga nakita na isang taon, hindi mo na miss, hindi mo na yan, natin mo na yan, pamigay mo, mag-garage sale ka, you know? And then, or if you really have to throw, yung challenge now is throw at least 5 things a day.
Oh.
Pag-declutter ka niyan. Tingnan mo kung magawa mo, ha?
Mahirap yan. Challenge yan. Especially if yung itatapon is a sentimental value.
Yes,
so it's really, really hard. I know you can agree with me.
5 things. Think about how you can declutter. And I'll tell you something pa, ha?
Go.
You better garage sale or pagpagay mo na lang the shoes and the bags.
Oh my
You know what I discovered? You know, your shoes, if you don't wear them, they look buko pa, but after so many years not wearing them, pag sinuot mo, natatanggal.
Yes.
You know?
Even mga bag, shoes, yung mga yan.
So it's 2 years na since the pandemic. I'm sure you guys are seated there, baka nakachinelas.
It's a secret.
So, just put it outside your garage or gate and somebody can pick it up and may makikinabang instead of us. You know?
I-add ko lang, Doktor, ano yun, kita namin sa'yo that you have passion to help and to give. Yun
Very
ka.
much so.
So,
shall we proceed to the games?
I think so.
Okay. So, very simple lang naman po yung game natin. So, we would have to call this Would You Rather. And it's a game that poses a form of question, beginning Would You Rather, and you're just gonna choose between 2 things.
Ayan, we're challenging you this time. Ito naman yung ganti namin. Sa pangit ng term ko, ganti at challenge.
Anything I say will be used. Yes.
All right, are you ready, Doc?
Yes, I am.
Okay. First question. Go back in time or go to the future?
Go back in time.
Would you rather have wings to fly or fins to explore under the sea?
Wings to fly.
Ay, agree din ako dyan. Gusto ko lumipad. Parang Superman. Hindi ko talaga ako eh, no?
Okay, next question. Be an artist or beauty queen?
Artist.
I see. All right.
Eh, pag-asa pa ako maging artist.
Okay, so would you rather spend your free time watching movies or listen to music?
Listening to music.
Yeah.
Oh. I think that ends our game. Very fast-paced lang siya. So before we end our episode today, do you have anything to say to our viewers?
Or invite anything, future activities or speaking engagement or whatever. This is your time to shine. To shine!
Bakuna.
Tama ka dyan.
Bakuna and continue to observe minimum public health standards. So, use your, mag-face mask pa rin, mag-face shield, kahit sinasabi ng mga bigger powers na no more na face shield, you know, please use your face shield, and then social distancing. Kung hindi ka rin lang kailangan lumabas, utang na loob. Kasi ang bottom line naman, kaya ka nahahawa kasi naka-exposure ka. Kung hindi ka sa bahay, yung expose, okay? So kung wala ka rin lang business to do outside, please stay at home. And kaya natin ito. Kaya natin ito. You know, we will come out of this. We will be victorious. So kaya natin ito, konting tiis, konting tiyaga.
Yes.
All right. Doc, ayaw pa namin matapos. Kaya now we have to end our conversation na I hate it. I'm sad. I'm sad talaga. No. Thank you for joining us, Dr. Maria Consorcia Quizon, and for sharing your expertise with us. Not just, epidemiologists, but also this is from me, personal, message for your passion to give and to help other people. Thank you for that.
Thank you.
My honor and pleasure.
Now, you can watch Spotlight live every Thursday at 2 p.m. on Daily Tribune's official Facebook page and Tribune Now on YouTube for the replay of the latest episode. I am Venice Bautista.
And I am Kim Sancha, and this has been
Spotlight.